Welcome to The Explainer. Today, we're diving right into a genuinely radical new solution for one of the most complex crises we're facing in America today. We're talking about the massive nursing shortage, the endless backlog of care for our aging population, and a healthcare system that is, quite frankly, bleeding money. But we're also going to look at an innovative fix coming from a totally unexpected place. We'll be tracing the narrative of Abbycare, which is this health tech company that is completely redesigning how we even think about the healthcare workforce.
The beating heart of this entire movement really boils down to this quote from Javi Nguyen, the CEO of Abbycare. She asks, who is the absolute best person to care for a patient? Well, the traditional system assumes it's a stranger in scrubs. But Nguyen pushes back on that. She says, no one can care best for the patient than someone who truly knows you. It's a huge emotional hook, for sure, but it's also just deeply logical. I mean, if we want better health outcomes, why in the world wouldn't we empower the people who are already the most invested in a patient's survival and happiness? To really understand how this philosophy became an actual business model, we have to look at where the story begins.
Section 1. A childhood on Medicaid. Because, the foundation of this company didn't start in some flashy Silicon Valley boardroom. It actually started in a nail salon in Texas.
This whole origin story starts with some pretty intense personal sacrifice. Nguyen's parents emigrated from Vietnam with almost nothing, and they worked relentlessly weekends, holidays, you name it, in their nail salon just to keep the lights on. But here's the kicker. Because her parents weren't fluent in English, Nguyen had to become the family's official translator for the Texas Medicaid system at 9 years old. Just imagine the heavy emotional weight on a kid that age. She vividly recalls the absolute paranoia of filling out these complex manual paper documents late at night, rushing them to the post office and obsessively checking the mailbox. She knew that if they missed a single piece of mail, her little sisters could lose their health coverage because paying out of pocket just was not an option. That sheer desperation to navigate a broken system, that became the very DNA of the company she built later.
Moving on to Section 2, the American caregiving crisis. And guys, this is a full-blown nationwide emergency.
60 million. To wrap your head around that number, that is roughly the entire population of Italy. There are 60 million family caregivers in the US right now. These are moms, dads, and adult children who are stepping up every single day to care for their aging parents or maybe children with disabilities. We've got this huge aging population and a massive nursing shortage, which means millions of Americans are stuck on waiting lists for weeks or even years just to get at-home care. And those 60 million unpaid family members, they're the ones carrying the weight, desperately trying to fill that void.
And this lack of systemic support creates a terrible ripple effect across our entire economy. First off, everyday families living paycheck to paycheck just literally cannot afford to pay out of pocket for private home care. It's wildly expensive. Second, because they aren't getting consistent, preventative care at home, Medicaid patients often end up rushing to the emergency room when a crisis hits, or worse, they get forced into institutional care like group homes or nursing facilities. Families are making these agonizing choices, like having to choose between buying groceries and putting a loved one in a facility. And on a macro level, all those ER visits and nursing home stays drive government Medicaid costs absolutely through the roof. It is a lose-lose-lose scenario.
Section 3, the Uber of healthcare. This is where we talk about fixing that supply problem. And this brilliantly illustrates the core shift in perspective here. Think about it. Just like Airbnb increased the supply of places to stay and Uber increased the supply of rides by tapping into everyday drivers, Abbycare is looking at the healthcare crisis as a fundamental supply and demand mismatch. If you don't have enough clinicians, people have to wait. But what if the supply is actually already there, it's just completely unrecognized? Abbycare increases healthcare supply by empowering those 60 million everyday family caregivers. They are, without a doubt, the largest untapped care workforce in the country.
So how do you practically take a family member and turn them into a recognized paid professional? Well, it's a pretty clear path. First, Abbycare gives the family caregiver free clinical upskilling and training so they have the exact right skills. Second, every single caregiver gets assigned a dedicated nurse case manager. This nurse acts like a quarterback for the family, someone they can text anytime for support or tailored care plans so they never feel like they're flying blind. And third, the caregiver actually gets paid for their work. How? Abbycare partners directly with managed care organizations. Those are the companies working with Medicaid. Because keeping patients at home is so much cheaper for the government than paying for a nursing home, these partnerships allow the whole program to remain totally free for the families while giving the caregiver a real income.
All right, Section 4, combating fraud with AI. Because when you're dealing with Medicaid, you absolutely have to replace those outdated manual systems.
You see, for decades, home health has basically run on faxes, manual charts, and paper logs. That gives health plans almost zero visibility into what's actually happening inside the home. Well, Abbycare completely scrapped that and built a seamless tech-enabled experience. Through an app right on their phones, caregivers document the care they provide in real time. This captures exactly what care was delivered, exactly when, and exactly where. It creates this incredible level of transparent data capture that regulators and health plans absolutely love.
But the real magic? That's happening quietly in the background through AI. Artificial intelligence is constantly analyzing all that real-time data. It's using agents to verify that caregivers are uploading the right documentation during onboarding. It monitors the daily logs to flag clinical progress, and, this is crucial, if something looks off, the AI automatically escalates medical issues straight to the clinical team. It's an incredibly smart way to ensure top-tier patient safety while cutting out fraud, waste, and abuse.
Section 5, Building a Caregiver Community. It's time we talk about the isolation factor.
The emotional reality of being a caregiver is extraordinarily heavy. Take a look at this feedback from one of the early moms on the platform. It's tough to read, but it's essential to understand. She was super grateful to be trained and compensated, but she still admitted, "I just can't help but feel burnt out and isolated and just very lonely." The truth is, at-home caregiving can be a deeply lonely road. You are in your house, day in and day out, carrying the entire weight of someone's health on your shoulders.
So, recognizing that profound emotional toll, Abbycare realized they had to go beyond just clinical documentation. They built a dedicated community platform. It started out digitally, families sharing stories, passing around resources, even doing virtual book clubs. But then, it naturally spilled over into real life. Families started coordinating playdates through the app. Fast forward to today, and they actively host local community meetups in every single market they operate in, literally bringing families out of isolation and giving them a lifeline.
And if you want to know what this community actually looks like in practice, listen to this story. During one of the early in-office onboarding sessions, two mothers just happened to sit next to each other. One mother had a 5-year-old son with autism. The other mother had a 16-year-old son with autism. The mother of the younger boy looked across the table and realized she finally had someone to talk to who was exactly 10 years ahead of her on the very same challenging journey. What was supposed to just be a basic onboarding requirement blossomed into this lifelong support system. Those two moms are now constantly hosting events and bringing other isolated families together. Let's wrap up with Section 6, a path to new lives. We're talking real economic mobility here. I want to introduce you to an anecdote that the CEO refers to as the DoorDash Dad. It's a story that completely captures the massive potential of upskilling our hidden workforce. So, there was this father caring for his daughter who had severe epilepsy. Her needs were unpredictable, making a traditional 9-to-5 job basically impossible for him. To keep food on the table, he was driving for DoorDash. It gave him the flexibility he desperately needed, but obviously not much long-term stability. Well, through Abbycare, he didn't just get paid to care for his daughter. He actually took their training and became a fully certified nursing assistant, a CNA. Just a few months later, he checked back in with the team. Actually, he had completely quit DoorDash. He had found his calling. Armed with that new certification, he started picking up shifts at local hospitals and care facilities. He took the skills he learned caring for his own daughter and started using them to heal his neighbors.
I think Hobby Nudian sums it up perfectly here. It's not just a paycheck. We're giving families a chance at a whole new life. By giving these family caregivers access to education, clinical backing, and actual compensation, this model is quite literally delivering a brand new version of the American dream. It takes folks who are backed into a financial corner and empowers them to build entirely new careers in a healthcare system that desperately needs their passion.
Which brings us to our final thought. Right now, regulators everywhere are facing tough budget cuts, and some are even talking about cutting pay for caregivers. But let's look at the facts we've laid out. If keeping patients safely at home is drastically cheaper than institutional care, and if training these families creates real economic mobility while simultaneously solving the nursing shortage, well, if family caregivers are truly the backbone of our healthcare system, isn't it time we finally invested in them instead of cutting their resources? It's a win for the patient, it's a win for the caregiver, and it's a huge win for the system. Definitely something to think about. Thanks so much for joining me on this explainer, and keep learning.